Hello, my name is Andreas Philip, and I'm a clinician in the field of neurorehabilitation from Switzerland. And I was invited by Dr. Mahesh Sahu for giving a 2-day course about the field, a very new field, and it's called functional neurology. So what's it all about in this field? It's compared to the neurorehabilitation treatment that we nowadays have, where we treat a lot of patients with already having a stroke or having traumatic brain injuries. This field is more into having patients or people just before they have something like a stroke or something like Parkinson's disease. So every one of us will have some brain decline in his life and in his career. So when you think about when you were a baby, when you start to walk, you fall down, you hit your head, your mother is changing the diaper and you fall down, and then you get 5 years old, you play soccer, you were hit by a ball many times, and then you were 18 having a car accident. So all these small traumas, they will lead someday to a brain decline. They can start with 30 years old, can start with 40 years old. So it depends how many lesions the patient, this person already had. So this is a big difference to the school medicine approach or above the healthcare system that we are in, because we just usually treat somebody who has a diagnosis. So it's in this point of view already too late, but we don't, and this is what we call a healthcare system. But actually it's not a healthcare system, it's more a disease care system, because the disease has to be here, that the school medicine is giving medication, is giving this dysfunction a diagnosis. And what we want to do and what we see is very, very, very effective if we see the person. So I don't want to call them patients, because patient means he has an ICD code, so a code from the International Classification of Diseases. So we want to start the interventions much earlier, because as I told you, everybody of us have brain decline already. So in comparison to any other kind of manual therapies in the field of physiotherapy or chiropractic, we check the brain functions. We check the brain functions from the pontomedullary reticular formation. We check the brain functions of all the cranial nerves. We check the brain function of the cerebellum and the vestibulum system, and of course of the frontal lobe function. So in this course, the students have learned to scan very quickly the main function of those mentioned neurological structures, to just see where the patient or the person is. And this is, I think, the biggest thing of this technique called Functional Neuroceptive Technique, because nobody cares about the brain. So if you're into the field of neurorehabilitation, they do this. But any other kind of therapist, they don't check the brain. So if I touch somebody, if I treat and mend a knee with a manipulation, they think they do something in this joint. But we think when I touch someone or manipulate someone, this information goes up to the brain. So what I was teaching this today is that we can literally touch the brain by adjusting specific manipulations on one side to get a reaction on the other side. And the main thing that we see is so-called hemisphericity. This means that your two hemispheres, they should have a balance in its function. But hemisphericity would mean that because of the trauma that someone had, you get a disbalance. And so a disbalance would mean, in this case, the left hemisphere is getting weaker than the right hemisphere. And if we have a weakening in the hemisphericity, also motor dysfunctions will appear. And this is what we see when we challenge the brain. But you only see it if you challenge the brain functions. Otherwise, it's not on your radar. And yeah, this was the main thing of these two-day courses, that we wanted to change the point of view of every therapist in this course, to check first the brain functions and then go into the peripheral system of the patient. Thank you.